Vicky Money, Executive Director of the European Coalition for People Living with Obesity. What are the needs nowadays for the people with obesity at European level?
So I would imagine that many of my colleagues, many of my friends, family members and people who live with obesity, those of national associations, would like to see disease recognition actioned in the healthcare system. Therefore, they are not waiting years and years for access to an appointment. They're not waiting until they have cardiovascular disease or hypertension or diabetes to be diagnosed with obesity, which was a gateway disease. So really and truly, we need the action in the healthcare system. We don't just need it recognized by our governments across Europe, by the European Commission. We need the action in the system. We have a huge problem with obesity where it can be environmental, socioeconomic, genetic, it can be neurological, it can be psychological. There are many, many factors that play a role. If you're in a low income area, you need reimbursement to treatment because you can't afford the treatment. You need access to a healthcare system, a multidisciplinary team that is going to actually give you treatment for obesity that will prevent another NCD. As we know, obesity is linked to over 200 other conditions, and there is no other disease like that.
Okay. According to the European Coalition for People Living with Obesity, what kind of action, you told me earlier, but what kind of action among the stakeholders, such as UN, such as G7 or G20?
Yeah. This is a huge responsibility for our stakeholders, predominantly because obesity is not just some people say an epidemic or a pandemic, it's a syndemic. It is 1 in 8 billion people across the world. We have 780 million people in Europe. 1 in 3 people almost have overweight or obesity. So for them to take this on, it is a huge task. However, even if we get the action within the healthcare systems, the healthcare systems have our primary care and our healthcare physicians, our healthcare providers, our surgeons, who don't have education to obesity as a chronic disease. They're overwhelmed, our healthcare systems are overwhelmed, and they haven't been given the opportunity to be educated. They don't realize that obesity can be connected to so many other disease areas. They don't realize that it can be the founding cause. So we need education in the healthcare systems. We need prevention as well. We cannot leave out prevention. We need education in schools. We need to break down obesity stigma and stop children from bullying each other or shaming and saying, that's your fault. You're lazy, you're gluttonous, you're sloppy, you're not eating the right things. People with obesity in general are the people who are going to the gyms and on the weight loss programs and trying their hardest. But without the disease recognition, the education in the systems, well then our policymakers and other stakeholders working together, they cannot take that on alone. It is a shared responsibility between all of us to actually make the action happen. And for far too long, we've actually sat by and there has been no action. There has just been strategies which are public health promotion, eat less and move more, and that's not good enough anymore. And we now recognize that. So the cause of inaction in obesity is what's showing us now that unless we all work together and accept that patients are disease experts as well in their own right and have an equal seat at the table, well then we're not going to move forward quickly enough.